Welcome to the deep dive. Today we're focusing on something really core for family medicine practice, helping our patients right here in Singapore quit smoking and manage their tobacco dependence.
Yeah, it's such a big deal, isn't it? Smoking is still a major cause of illness and, well, death here.
Absolutely. And even small improvements in quit rates, they add up to a huge positive impact on public health. Plus, cessation is known to be one of the most cost-effective things we can do in medicine.
For sure. And the good thing is we actually have solid evidence-based recommendations. We've got practical frameworks like the 5 A's, which are honestly super useful in a busy primary care setting.
Right. So to make this as practical as possible for you, our family medicine residents listening, we thought we'd actually walk through a role play scenario, something you genuinely encounter, day to day in clinic.
Mm-hmm. A good chance to see these ideas in action.
Okay, so let's set the scene. Imagine Mr. Tan Ah Beng, he's 48, comes in for a routine hypertension check. His BP, well, it's still a bit up, maybe 145 over 90, even though he's on amlodipine.
A classic scenario. And exactly the kind of situation where you think, okay, we need to tackle lifestyle factors, smoking being a big one.
Exactly. So you, the resident, start the consult, check his BP, ask how things are going, and Mr. Tan says,
Doctor, actually. I've been thinking. I think I need to try quitting smoking again. My wife, she keeps nagging me, and this cough, it's really getting to me. Plus, I know it's bad for my blood pressure. But I'm just worried I'll fail again like all the other times.
okay, wow. That's quite an opening from Mr. Tan. So if you're the resident hearing that, what's the first thought? How do you sort of gently pivot into that conversation?
Well, him bringing it up, even with that fear, that's your in. You want to acknowledge his readiness, but also immediately link the smoking to his current health issues in a very personal way.
Right. So maybe something like Mr. Tan, it's really good you're thinking about quitting again. That takes courage. And you're right, quitting would make a big difference for your blood pressure and also reduce your risk of heart problems, especially, thinking about your family history. And that cough you mentioned, very likely linked to the smoking too.
Exactly. Clear, direct, personalized advice. Then you need to assess. You need more details, his habits, dependence level, what happened before. So a good next step is, Mr. Pan, can you tell me a bit more about your smoking right now? Like how many cigarettes would you say you smoke each day?
And Mr. Tan replies,
Usually about a pack, maybe 20, the red Marlboros. Started young, probably when I was 18.
okay, 20 a day since 18. That's significant duration and quantity. What else helps gauge his nicotine dependence level?
Yeah, key questions are about that first cigarette in the morning, how hard it is not to smoke where he shouldn't, and if he smokes even when sick. So you might ask, and Mr. Tan, how soon after you wake up do you usually have that first cigarette? Is it tough to avoid smoking in places like, say, work sites or non-smoking areas? And do you still smoke even if you've got a cold or flu?
And Mr. Tan would likely say,
Oh yeah, definitely within half an hour of waking up, I need one. And yeah, it's hard not to smoke sometimes, even where I shouldn't. And yeah, even if I'm sick, coughing, I still smoke.
okay, those answers really point towards a moderate to high level of nicotine dependence, don't they?
They really do.
You also mentioned failing before. Exploring those past quit attempts is so important.
Crucial. You need to know what he tried, how long it lasted, and critically, why he relapsed. What were the triggers? So you'd follow up with, you mentioned trying to quit before, Mr. Tan. Could you tell me a bit about what happened those times?
And Mr. Tan shares.
Ugh. I think I've tried, seriously, maybe 5 or 6 times. The last proper try was about 2 years back. I used those nicotine patches, the 21 milligram ones from the polyclinic. It worked for a bit, maybe 3 months. But then work got super stressful, deadlines. And all my colleagues, they smoked during breaks. I couldn't resist, had one, and poof, back to square one. Felt terrible about it, so I didn't even go back for the follow-up.
Yeah.
The patches helped a bit at first, though. The other times, just cold turkey. Longest I lasted was maybe 2 weeks. Stress or, going out for beers with my mates. That always gets me.
Right. So some partial success with NRT, the patch anyway. But work stress and social smoking were definite relapse triggers. And cold turkey didn't get him very far. Useful intel.
Very useful. Now we need to understand his current motivation. Why quit now? And what does he see as the main triggers and barriers this time around? So you could ask, what's making you want to quit this time, Mr. Tan? What are the main reasons? And thinking ahead, what situations or feelings usually make you reach for a cigarette?
And he tells you.
Well, it's my health, mainly. This blood pressure thing, this nagging cough. Sometimes I feel a bit breathless, just climbing stairs. And my dad, he passed away young, heart attack. Smoker too. Plus, honestly, cigarettes cost a bomb now. And my wife, she really wants me to stop.
Strong motivators there: health, family history, cost, family pressure.
Mm-hmm. And the triggers. He'd probably say, definitely stress from work, managing my team, hitting targets, coffee breaks are hard, everyone smokes. Oh, and right after eating, always. Then weekends, having beers with my friends who smoke, and sometimes, yeah, just when I'm bored.
Okay, classic triggers. Stress, social cues, routine, boredom. It's also really important to get his worries out in the open, right?
Absolutely. You need to know what he's afraid of so you can address it. A direct question works best. What are your biggest worries or concerns about trying to quit again this time, Mr. Tan?
And Mr. Tan might express.
Honestly, I'm just scared I'll fail. Again. And the withdrawal. Last time I tried cold turkey, oh man. I was so irritable, couldn't concentrate on anything. I'm also worried I'll put on weight. My friend gained loads when he quit. And how am I supposed to handle work stress without smoking? Plus, avoiding my smoking buddies. It's going to be tough.
Yeah, those are all very real, very common concerns. Fear of failure, withdrawal, weight gain, stress coping, social pressure.
Yeah.
So before jumping into solutions, let's gauge his readiness. That importance in confidence scaling is useful here.
Definitely. Just straightforward. Mr. Tan, on a scale of 0 to 10, where 10 is extremely important, how important is quitting smoking to you right now? And using the same scale, 0 to 10, how confident do you feel about actually succeeding this time?
In Mr. Tan's likely response.
Importance, oh, that's high. Like a 9 out of 10? Definitely. Confidence, that's tougher. Maybe a 5. I really want to, but yeah, you hear that hesitation. I haven't picked a date or anything.
High importance, moderate confidence, very common starting point.
Yeah.
He's motivated but needs help building that self-belief and a solid plan. So this brings us neatly to the assist part of the 5A's. Let's start with behavioral support strategies.
Right. First off, based on his past attempts and general evidence, it's worth mentioning that quitting abruptly, going cold turkey but with support, this time usually works better long-term than just trying to cut down gradually.
Good point.
Then we need to tailor strategies for his triggers. The work stress, the coffee breaks, the weekend beers, the boredom. It can't be generic advice.
So maybe frame it like Mr. Tan. Research actually shows that picking a quit date and stopping completely on that day often gives people the best chance. So let's focus on that. And we need to brainstorm some concrete ways for you to handle those specific tough moments, like the stress at work or those coffee breaks with colleagues. What could you do differently then?
And involving his support network is key. His wife is already encouraging him. Maybe discuss how she can help or how he can talk to his friends about needing their support, not pressure. And setting that quit date is vital. Given his 5'10" confidence, maybe suggesting a date within the next couple of weeks gives him time to prep but keeps the momentum. But it has to be his date.
Yeah, absolutely. How would you feel about setting a quit date, say, about 2 weeks from now, Mr. Tan? That gives us time to get a plan ready. And between now and then, maybe think about who else, besides your wife, could be a good support for you. And let's think about how you might handle those coffee breaks or weekend drinks differently. And critically, we need to tell him about local resources.
Yes, don't forget those. The Health Promotion Board's I Quit program is excellent. Mentioning the Quit line 1-800-438-2000 gives him immediate access to phone support, and community pharmacies are getting more involved too.
Exactly. Mr. Tan, you don't have to do this alone. There are great resources here in Singapore. HPB has the I Quit program with personalized support. There's also a quit line you can call anytime you need advice or just a boost. And many local pharmacies can help too. Okay, so that's behavior. Now, pharmacotherapy. Given his dependence level, combination NRT seems like a really strong contender.
Definitely. We should explain why. Using a patch for that steady baseline nicotine level helps control the background cravings, right? And then having something short-acting like a lozenge, gum, or mouth spray for those sudden breakthrough urges, that combination is very effective. Significantly boosts quit rates, really, regardless of dependence level.
And it's worth explaining the different short-acting types briefly, perhaps. Like the lozenge is quite discreet for work, the spray works super fast for intense cravings, helps with shared decision-making.
Precisely. We should also touch on Vernicline, explain how it works, reducing cravings and the pleasure from smoking. But we have to mention the current supply issues, unfortunately. And note, the main side effect is often nausea.
Right, and bupropion.
Mention it as an alternative, yeah. Registered for depression here. Used off-label for smoking cessation. But, frankly, it's generally less effective than varenicline or combo NRT, and more people tend to stop it because of side effects like dry mouth or stomach upset.
It's probably helpful to contrast the effectiveness of these options against placebo,
Yeah.
just to reinforce the benefit of using something. And the whole conversation needs to be collaborative, a shared decision. Discuss the pros, the cons, address his worry about needing a crutch or side effects.
Absolutely. So you might say something like, Mr. Tan, because you smoke about 20 a day and need one quite soon after waking, using some form of nicotine replacement, NRT, could really double your chances of quitting successfully compared to going it alone. A really effective way is often using two types together. A patch for all-day control, plus something like a lozenge or a fast-acting mouth spray for sudden urges. The lozenges are discreet, the spray is quick. There's also a pill called varenicline, very good, but there are some supply problems right now. Another pill, bupropion, is an option too, though maybe not quite as effective as the others for most people. How do these options sound to you? Any initial thoughts or concerns about using medication to help?
That really opens it up for discussion. And given his dependence, gently steering towards combination NRT seems clinically sound.
I agree. And then the final layer range, setting up that follow-up.
So critical, because the highest relapse risk is right at the beginning, isn't it?
Exactly. Those first few weeks are make or break for many. So we need a concrete plan. Aim for contact, maybe a call or a quick visit within the first week or two after his quit date. Then schedule regular follow-ups beyond that.
What are we monitoring in those follow-ups?
Key things: smoking status, any slips or full relapse. How are the withdrawal symptoms? Is he taking the medication correctly if he chose that route? What triggers are popping up? How's his confidence holding up? Basically checking in on the whole plan and adjusting as needed.
Okay, so wrapping up that part of the consult. So, Mr. Tan, let's aim for that quit date 2 weeks from today, okay? And I'd like to see you back here or give you a call about a week after that date just to check in and see how things are going. How does that sound? We can plan more check-ins from there.
And hopefully Mr. Tan agrees. Okay, so that concludes the role play bit. Let's step back now and maybe unpack some of the key clinical pearls from this, specifically for our family medicine residents listening.
Great idea. Let's debrief. First off, the 5A's framework itself. It just provides such a useful, systematic way to approach this, doesn't it? Ask, advise, assess, assist, arrange. It turns it from just asking, do you smoke, into a structured intervention.
Totally agree. And that ask step really should be routine. Every patient, every suitable visit. For assess, it's not just the number of cigarettes. It's digging into that dependence time to first cigarette, smoking when ill, and really exploring those past quit attempts. Why did they relapse? That's gold for planning the next attempt. Using a tool like the Fagerstrom score can also help quantify dependence, give you a number.
And the personalization, we talked about tailoring the advise and assist steps.
Mm.
We saw with Mr. Tan how linking it to his BP, his family history, his specific work stress, his social triggers, that makes the advice stick.
Yeah.
It's not generic. It's his reason to quit and his plan.
Exactly. And when we get to assist with behavioral support, it's about practical strategies. Addressing his barriers, the fear of failure, the weight gain worry, explaining withdrawal is normalizing it, identifying his triggers, and offering concrete coping mechanisms like those 4Ds. Distract yourself, delay the urge, drink water, take deep breaths. Simple, but can be effective in the moment. Plus, mobilizing social support and, crucially, setting that quit date together.
And on the pharmacotherapy side, specifically for Singapore, combination NRT really emerges as a strong first-line choice, especially for moderate to high dependence like Mr. Tan. It's effective, accessible.
Right. And remember shared decision-making for the short-acting form lozenge, gum, spray. Patient preference matters for adherence.
And we have to be aware of the current varenicline situation that might not be available. Bupropion remains an option, but usually second or third line due to efficacy and side effects. And don't forget the potential for government subsidies for NRT here in Singapore, often linked to a Fagerstrom score of 3 or more. Worth checking eligibility for your patients.
Definitely check that. And arrange the follow-up. We can't stress this enough. Relapse risk is highest early on. Regular contact, monitoring smoking status, withdrawal, medication use, ongoing triggers, it's all vital.
What about lapses? If Mr. Tan slips up and has a cigarette a month after quitting?
That's a really important point. Frame it as a lapse, not a failure. A learning opportunity. What triggered it? What can we do differently next time? Encourage him to get right back on track immediately, not let one slip derail the whole attempt.
Good advice. And one other clinical point, those medication interactions when someone quits. Smoking, induces the CYP1A2 enzyme.
Yeah.
So when they stop, levels of drugs metabolized by it, like clozapine, olanzapine, even warfarin or clopidogrel can go up, something to keep in the back of your mind, potentially requiring dose adjustments.
Yes, that's an important safety consideration, especially with certain psychiatric meds or anticoagulants, and for relapse prevention long term. Sometimes extending the NRT or other medication beyond the standard course can help for high-risk individuals. Plus, ongoing reinforcement of coping strategies and the benefits they're experiencing.
Okay, so let's try to summarize the key takeaways for family medicine residents. Number one, routinely ask and advise about tobacco use. Make it standard practice.
2. Use the 5 A's as your structured approach. Assess dependence, readiness, history thoroughly.
3. Assist with personalized behavioral support and pharmacotherapy. Combination NRT is often the go-to first line here. Shared decision-making is key.
4. Arrange consistent follow-up. It's absolutely crucial for success, especially early on. Monitor, support, adjust the plan.
As primary care doctors, we're really perfectly positioned to tackle this. We see patients regularly. We have that trusted relationship.
Exactly. You're on the front lines. And by consistently applying these strategies, you can make a huge difference. Helping even one patient quit successfully prevents so much future suffering and potential premature death. It's incredibly impactful work.
Definitely. So encourage your patients to use the local resources, the I Quit program, the Quit line. Tailor your approach to each individual. There's no one-size-fits-all.
And maybe a final thought for everyone listening. As you go into your clinics this week, think about your patients who smoke. How could you perhaps integrate one or two of these strategies? How could you open that conversation? Imagine the real, tangible improvements you could help facilitate in their health, their lives. It's a powerful part of what we do in family medicine.